Hi, everyone. Thanks for joining the session. My name is Vian Vu, and I'd like to present to you mine and my collaborator study titled Race Demographics within the American Academy of Sports Physical Therapy Membership and Leadership. First, I'd like to thank the DEI committee of the American Academy of Sports Physical Therapy. We all meet once a month to talk about really tough situations in order to set some actual items to increase diversity within the organization. Second, I'd like to thank the organization themselves. They're very supportive towards our DEI initiatives and also funded the submission of this platform session. I'd also like to thank Christina Gomez, my colleague. She was an integral part of the study. She was a driving force in getting this study off and running and done within a matter of weeks in order to submit for platform. So some background on this topic is that racial bias can affect patient care in a negative way. As early as 1999, there were some studies looking at how physicians referred and provided interventions to patients. They had two patient groups. They had a white patient group and a black patient group. And these were all actors. And these actors were told to present the same symptoms subjectively, meanwhile giving the same facial expressions, as well as the same body gestures. And what they found is even when the white group and black group had matched symptoms, body gestures, and facial expressions, they found that the white group was more likely to get the correct intervention or referral compared to the black patient group. Unfortunately, as recent as 2018, Mina looked at implicit bias test studies in a systematic review and found that it still exists prominently today. And these tests also compared it to patient communication interventions. And it shows that about the racial bias, about 80% of those studies were towards communications and showed that it had a negative effect. The more someone was implicitly biased towards a race, they were more likely to be give poor communication towards that race. Secondly, there was about 30% of studies that looked at either intervention alone or intervention and communication of those studies, and they found that implicit bias relates to that as well. It also affects the workplace. So when we have better minority representation in leadership and workforce, we find that there's better outcomes in profit and marketing use and effectiveness. And this is largely theorized due to more openness and trust within the workforce to provide better ideas to reach to different groups to be more successful in the organization. And then lastly, unfortunately, minority representation is poor in healthcare. Looking at this study here, when they look at a Black demographic and Hispanic demographic, we find that compared to the US Census, not many Hispanic or African-American or Black members make it to the medical system. So looking at medical school graduates, GME pools, so residencies and fellows, and also attending physicians, it seems to be half or less than the US Census representation. It's not isolated towards physicians alone though. In 2019, Sharon Dunn in her presidential address said, we're gonna need an all hands on deck approach to fix this problem within the PT profession as well. That stemmed Eric Mera of the executive board to start the DEI task force in January 2020. Once that got started, we all met at CSM last year and we talked and had a lot of initiatives, and the executive board decided that this is a very big issue and they're gonna make it an official committee. So as a committee, we have a lot of initiatives, but in order to start these initiatives and measure how effective they are, we have to ask a few questions. And the first question was a question for the study. What does the ASPT membership look like? And what does it compare to the leadership? Is there equal representation that reflects the membership? And then how does the ASPT compare to other organizations? So if we had poor representation, well, is that comparable to other organizations? That's what we wanted to answer. So first we had to identify those organizations before you could collect membership data. So we looked at, of course, the ASPT and APTA, but we also looked at NADA because they're sports rehab specialists and athletic trainers as well. Then we also looked at our sports medicine primary care colleagues in the American Medical Society of Sports Medicine and the American Orthopedic Society of Sports Medicine. Once we found that, we looked to acquire data. So the ASPT was private. We had to ask our director of membership to give us the data. APTA was open to members only. NADA was also open to members only. However, they did happen to have the recent 4 years publicly online. AMSSM was private. They actually did not collect this kind of data. They do have data of gender. However, that'll be presented more from my colleague Christina, who's going to present this exact same study, but looking at race and gender in a different session. But they had data for that, but they didn't have data for race. And then we looked at AOSSM. Unfortunately, it's private. They said members only. So technically that'd be exclusive. However, they give us the annual report, which they said the data was in, which members get. Looking at that, there wasn't quite the data we were looking for. So upon request, they were unable to provide us that data from the front office of the organization. So based on that, these are the three organizations that we chose to conduct our study on. So first, let's look at the comparison between AASPT membership and leadership. So looking at the minority representation, you can see in the membership that there's a little more diversity compared to the leaders, with the leadership being 100% white representation. When we look at 2017, it's the same thing, as well as 2018. In 2019, with some of the elected positions switching over, the trend of, or the representation actually inverted. So there's actually a greater, or there's more diversity in leadership than in the membership. When we compare it to the APTA membership versus leadership, we can see that each year, just like the other graph, that there is more white representation in leadership than membership. However, compared to the AASPT, there's at least more diversity across all 4 years compared to the AASPT, when we look at leadership strictly from the APTA to AASPT. To answer our second question of how does this compare to across all similar organizations, looking at the APTA and NADA, on the x-axis, you could see we divide into each demographic. And what we can see here is that in the past 4 years, percent change-wise, there's been a decrease in white representation in both APTA and NADA as well as AASPT. But you can see that the AASPT had a less of a decrease in white representation. One thing we did want to note was in the past 4 years, the APTA and AASPT increased in African American and Black membership representation. However, NADA had a decrease in it, quite a significant decrease too, compared to the other organizations. So based on our data and our study, what we found was not all healthcare organizations even collect the data or make it public. And I think in order to address this change, we need to measure these things in order to see if our campaigns and initiatives are going to be effective. It's also important to be transparent, because being transparent allows other organizations to work as a team and compare themselves to what would be considered good. So I think it's important that we collect this data and also make it public to be more transparent. Second, although there is more white representation overall in the AASPT and NADA and APTA, all organizations seem to be the same as far as percentage of white minority representation. Or sorry, minority, yeah, it seems to be similar levels of minority representation across all three organizations. Lastly, the APTA and ASPT have less minority representation in their leadership positions compared to their membership. However, recently in 2019, at least for the ASPT, it's trending in the right direction, whereas with the APTA, it's kind of stayed stagnant there. So in conclusion, there is less minority representation in leadership positions of these professional organizations. Future research should work to explain barriers and race discrepancy within the ASPT and APTA. So I think our next step is to look at qualitative studies, looking at barriers and also why minority groups are less likely to either choose to apply for these leadership positions or be elected in these leadership positions. And then lastly, more organizations should track race data to identify discrepancies. One issue we ran into was we actually intended to look at ethnicity, because as many of you know, race is more biological. So it's more of skin color and hair color, whereas ethnicity is what one identifies as culturally. And I think ethnicity is more important because it looks at a person's experiences rather than the biological traits. but we were unable to find ethnicity for any of these organizations. So I think a step forward should be asking for ethnicity rather than race. And I think another study can be done with that. Overall, our plan for this is to start these initiatives, and then we plan to do the study again in 4 years to see if there's been a significant change in the past 4 years. So I'd like to thank you all for viewing. Here are my references. I look forward to answering any questions you might have. Feel free to email me. My email is vienvu@gmail.com. That is vienvu@gmail.com. And this is a topic I'm very passionate about, and I can tell you the DEI committee is very passionate too. So again, thank you for all your support in viewing this session, and enjoy the rest of CCS STEM. Thank you.